My name is Michelle Gibson, and I will be fulfilling the second role of this presentation in discussing an article about neurodevelopmental disabilities, and more specifically, intellectual and developmental disabilities, which I will most frequently refer to as IDD. The article that I will be talking about is called National Health Surveillance of Adults with Disabilities, Adults with Intellectual and Developmental Disabilities, and Adults with No Disabilities by Susan Haverkamp and Haley Scott. And there is the reference for any of you that were interested in reading the article. And what this article is basically about, they did some research as to what types of care people with no disabilities had access to and utilized, what types of care people with a disability had access to and utilized, and then what access people with IDD had access to and utilized. And what the authors reveal in this article is that people with disabilities experience worse health and poorer access to health care than people without disabilities. It's somewhat ironic in the worst way possible, because people with disabilities often have a higher need for health care, and yet they have decreased access to healthcare services. In other words, there's a health inequity between those who have a disability and those who don't. Adults with IDD specifically are more likely to use tobacco, be overweight or obese, be physically inactive, have inadequate emotional support. A lot of that is due to social isolation, lack of skills to communicate, just a kind of a limited freedom to expand their social network, or establish friendships with people who would understand what they're going through. And they have a poorer overall health. And with these risks, when the authors were looking at the risks and healthcare, these are some of the barriers that they found of accessing healthcare for people with IDD. The first one is social stigma. There's an enormous social stigma surrounding people with disabilities. This complicates so many aspects of life, but even if we just look at the problems created by a stigma that impact one's access to medical care, potentially more transportation issues, definitely more difficulty, if not impossible, to use public transportation, finding a doctor who will oversee their medical care, which I'll talk about in just a second, treatments which may be appropriate for a non-disabled person, and that's the method of standard treatment for a condition. It may be confusing or overwhelming to somebody who has a disability. So obviously this list could go on for a while, but it really begins to open one's eyes about how social stigma impacts the medical care that those with disabilities receive. The second barrier is physical inaccessibility of healthcare facilities. And again, transportation to healthcare facility may be a huge barrier. And additionally, the person may have enormous difficulty getting through a building in order to get to the right office. So a lot of times just the physical aspect is enough to keep them away or prevent them from going. The third one is communication difficulties. Sometimes people with IDD aren't able to communicate what their physical symptoms are, and therefore medical providers have a greater difficulty in treating their medical issues because they don't exactly know what they are. And that's not true for everyone with IDD, but it can be an issue. A lack of medical information. Sometimes people with IDD and their caregivers may not know what issues to watch for. They may not know what they're at risk for. And therefore there's just a general lack of medical information that can prevent people from realizing that they need to pursue medical care over something that they're experiencing. A lack of provider training. So the article that I read did a study in Australia, and as many as 90% of general practitioners in Australia reported that it was more difficult to provide quality care to patients with IDD, and 16% stated that they would prefer not to treat people with an intellectual disability. Which that doesn't really say why. It doesn't say if it's because they are more difficult to treat, but overall it really suggests a lack of provider training, and that's definitely a problem and can be a barrier just with people getting the care that they need. Insurance constraints. Sometimes there's just a lack of healthcare coverage. There's greater healthcare needs in some situations, and yet there just isn't adequate coverage for the services needed. And therefore, some people with IDD just don't get the care that they need. Lack of preventative health care is a big one. It leads to poorer health, overall health, and therefore greater health problems. In general, there are just less referrals for health screenings, and this could be attributed to people with IDD having less understanding of preventative health, specifically screenings for cancer. And some of these screenings may require that the person with IDD have some extra support to overcome anxiety or reluctance or discomfort in agreeing to go through some of those screenings. They can be pretty uncomfortable, well, for all of us, but especially for people with IDD who may not understand what's going on exactly. And then lastly, negative experiences. Sometimes people with IDD have had a very negative experience with the healthcare system, such as experiencing disrespect, insensitivity, and devaluation. So they may not really be too interested in going back, or their caregivers may not be too interested in going back. So why is all of this important to us as social workers? Well, it's important because we have to understand what our clients are up against, what battles they're facing day in and day out. And of course, adequate medical care is just one of those battles, but it's an important one because we know that if someone's having medical problems, it can impact their emotional health and even impact a person being diagnosed with a disorder if the medical concerns aren't recognized. So we need to be aware of how much medical problems can impact a client, especially for someone who has IDD. So what can we do and what resources are available to us? So I did some research as far as resources that are online. The first one that I found is the ARC, and I really like this one, and I'll get back to that in a second, but there's over 700 chapters across the U.S., which I think is really awesome. It's a national community-based organization that advocates for people with intellectual and developmental disabilities and also their families. And the chapters provide, the 700 chapters that are across the U.S., provide various human services and other supports, including individual and public policy advocacy and residential, educational, and vocational services that allow people with IDD to participate and be included in their communities, which is hugely important in my opinion. And also based on this article, that was something that they were focused on as well. They also offer financial planning, recreational activities, and they strive to meet the unique needs of people with IDD. So I thought this one was really cool. I live in a very rural part of Oregon, and I wasn't really expecting there to be any chapters near me, and there actually were some near me, which I thought was really cool. The closest one is about 2.5 hours, which probably seems like a long ways, but I was expecting them all to be much further than that. So it's pretty cool. You should check it out to see if there's chapters near you. It can be a really good resource. The second resource I found is the Administration for Community Living. The thing that I liked about this one, well, let me back up. So what it is that it's part of the U.S. Department of Health and Human Services. Their fundamental principle is based on the belief that people with disabilities and also older adults should be able to live where they choose, with the people they choose, and fully participate in their communities. So you'll see that again. Just like the previous resource, they talked about being included and active in their communities. That's something that's really big to a lot of these resources that I found. But inherent in this principle is the core belief that everyone can contribute throughout their lives, which I love that. So the thing that I loved about this one is that they have a whole list of actual programs that they have. And I'm going to go through them. I know it's going to be a little bit lengthy, but it's a really good list. And it's really cool just to know how we can get involved and what resources are available. So, the State Councils on Developmental Disabilities engage in systems change and capacity building efforts that promote self-determination, integration, and inclusion for people with intellectual and developmental disabilities. The second one is State Protection and Advocacy Systems, which help individuals with developmental disabilities secure their human and civil rights. Projects of national significance help create and enhance opportunities for individuals with developmental disabilities to contribute to and participate in all facets of community living. National Network of University Centers for Excellence in Developmental Disabilities Education, Research, and Service. And it represents an expansive national resource for addressing issues, finding solutions, and advancing research related to the needs of individuals with developmental disabilities and their families. I really like how a lot of these programs are focused on not just the client, but also the family. I think that's really important. Here's some more of that same website. The President's Committee for People with Intellectual Disabilities. And the mission of this one is to provide advice and assistance to the President of the United States and the Secretary of Human Health Services on a broad range of topics that impact people with intellectual disabilities, which I think is really cool to just know is available, as well as possibly to get involved in. Help America Vote Act. Grants make polling places accessible to voters with disabilities. The next two are both programs that focus on independent living, and they have grants that are in place to facilitate that. You can check them out on the website and get a little bit more information on those if that's something you're interested in. And then the last three, so there's a Paralysis Resource Center, which provides comprehensive information for people living with paralysis and their families. The Limb Loss Resource Center, which works to empower people affected by limb loss to achieve their full potential through education, support, and advocacy. And lastly, Assistive Technology Programs work to improve access to assistive technology for people with disabilities. I know it's a long list, but each of these programs is a really unique program that is meant to meet specific needs. And I know for myself, sometimes I have clients that have a very specific need, but I don't always have the right resource, so I know that this list could be really good and it's going to be helpful to me, so hopefully to you too. And the last resource that I have in this presentation is the American Association on Intellectual and Developmental Disorders. And the three goals of this organization is to enhance the capacity of professionals who work with individuals with intellectual and developmental disabilities, promote the development of a society that fully includes individuals with intellectual and developmental disabilities. I love that second one. Sustain an effective, responsive, well-managed, and responsibly governed organization. Additionally, what I liked about this website is that it offers some education tools, some videos, as well as some journal articles that are specific to people with IDD, which is a great tool for learning more about people with IDD and what other issues they face and how we can best help them. This is, of course, important, for us as social workers, because it's just a tool that helps us help those that we're working with, and it's a great starting place to, just pursue our pursuit of ongoing education, which is crucial to us staying in touch with current issues and being best equipped to serve those we are seeking to serve.